And now let's get right to it. Let me introduce our first speaker. As vaccine distribution expands in the United States, how will it impact businesses' plans to return employees to the workplace? Let's ask Dr. Ashish Jha, Dean of the Brown University School of Public Health. He's joined by CNBC senior health and science reporter Meg Tirrell. Meg, the stage is yours.
Well, Tyler, thanks so much. And I can't wait to be back in person with you. I miss you, and I'm very much looking forward to today's events to try to get some clues about how we do that safely. So Dr. Jha, a person who I'm also looking forward to meeting in real life someday, thank you for being with us. For everybody out there, Dr. Jha's Twitter feed is an amazing source of information and perspective on this pandemic, so I encourage you to follow him there. Dr. Jha, let's just start with where we are right now in this moment. You know, we're making such progress with vaccines, but we heard that really stark warning from CDC Director Dr. Rochelle Walensky yesterday about cases rising again right now. How would you characterize this moment we're in the pandemic and what it means for the next couple months?
Yeah, so Meg, thanks for having me here. You know, we're at a pivotal moment. I mean, on one hand, the vaccinations is going so incredibly well. We're vaccinating close to 3 million people a day. I think that number is only going to go up in the next couple of weeks. I would not be surprised if we have 4 or 5 million in a day kind of days, and that's terrific. It's really helpful. The problem is that the variants are here. The B117, the UK variant, is now dominant, probably 50-60% of all infections in America from that variant. And that's causing a spike in cases that's kind of putting us in a tough situation. And then 2 other things are happening. States are opening up, and we still have a lot of people who are high risk who have not yet gotten their vaccine. So I am worried about the next 4 or 6 weeks, which feel to me like still a challenge. But once we get into May, and certainly by the time we get into June, things will be dramatically better.
And so does what we're seeing right now with the cases increasing and in some places really getting to, a very concerning level again, does it change the timing about when we potentially get back to normal with the vaccines?
Not much in my mind, because I think in the end, you've probably been hearing there's a race between variants and vaccines, but we know who's going to win. I mean, the vaccines will win. The question is, how many people are going to get sick and die between now and the time that 60-70% of Americans are vaccinated? I think that will happen around probably sometime in June, that we'll get to a point where, again, 60% of Americans are vaccinated. So the timeline doesn't shift so much. It's just how much suffering and death is going to happen between now and then that really concerns me the most.
Yeah, it's scary. So you say 60 to 70% of Americans getting vaccinated. Tell us about why that figure is the one you're focused on. We hear herd immunity from Dr. Fauci, anywhere from 75 to 85% of Americans. Why 60 to 70% to get the vaccine?
Yeah, so there are 2 things going on. Again, I'd love it if 90% of Americans got vaccinated, that would be fabulous. I mean, there are a couple of things happening. One, of course, is that kids can't get vaccinated yet, right? So even under the best of circumstances, we're going to have a chunk of Americans, people under 18, under 16, who are not going to be able to get vaccinated for a while yet. I think older kids probably later summer, younger kids maybe in the fall or winter. Second is there's still a chunk of hesitancy out there. About 10-15% of Americans are pretty dead set against getting vaccinated, and probably another 15% is pretty skeptical. So we've got to work on that. And in terms of herd immunity, there's no doubt that for herd immunity, we probably need to be well above 70, probably in the 80s or maybe even 90%. The issue is there's also a lot of underlying infection. A lot of people who are not getting vaccinated have been infected in the past. That adds to population immunity. So that's why I think if we can get to 60% of Americans, ideally 70% vaccinated, it will make an enormous difference.
And in terms of that hesitancy, are there things that employers can be doing to try to encourage their employees to get vaccinated? What are the best strategies that employers can take? Are mandates a good idea? What do you think?
Yeah, so I think the best way to persuade people is to persuade people. It's not to necessarily mandate it. And I think, again, there's a chunk of people who are skeptical, sort of more in the wait and see category. And I think they can be encouraged. You can have policies that allow for earlier return back to work when people are vaccinated. And obviously watching their coworkers get vaccinated will also encourage a lot of people. So I think there are a set of policies that employers can implement that'll help. Employer mandates are a different issue, and obviously there are legal issues there that I'm not an expert in. In general, if you want a safe work environment, there is no doubt about it that if everybody was vaccinated, it makes the work environment dramatically safer. If 20, 30% of your employees are not vaccinated, it's going to be much, much harder to bring people back in person. So that's a issue that employers are going to have to deal with, and a cost that they're going to have to manage if they choose not to either mandate or strongly encourage their employees to get vaccinated.
And then there's that whole issue, and maybe this is legal too, but I wonder how you look at it, about employees maybe having to prove that they're vaccinated in order to come into the office. How do you think through issues like that, where it's not as obvious as showing you've been tested because the employer's testing you? How do you prove you've been vaccinated, and how can employers require you prove that?
Yeah, this is a great question. And you've heard this week sort of rumblings from the Biden administration about maybe creating a vaccine passport. And people have been asking, should the government be involved in that? And what's clear to me is that you're going to see private sector solutions no matter what. And you're going to see countries, if you want to go fly to the UK or Germany or other places over the summer, you're going to have to show proof of immunization, and that proof is going to have to be authenticated. So there is going to be a need for this. In my mind, there's no doubt. We're seeing this in Israel, where people are having to show vaccination proof. So given that need, you can imagine the government playing a role in setting standards. I can imagine private companies playing a role in building some of these tools. But undoubtedly, in my mind, vaccine passports are going to be a part of how we manage the next year.
Well, let's talk about what the months going forward are going to look like, as best you can use your crystal ball for us, and yours is much better than most people's. You, I think, were the first person I heard give the date of July 4th as a date to shoot for some form of normalcy, maybe not perfectly. And now President Biden has adopted that date too, for a more normal July 4th, kind of an Independence Day in some ways from this pandemic. And It seems like most employers are talking about July or later as a time to start bringing people back as well. What do you hope to see in terms of vaccination rates by that point, and also case numbers? I talked with Dr. Fauci yesterday, who said he really doesn't want to see offices bringing people back until case numbers in the country are below 10,000 a day, which just seems like, wow, how do we get there? Could we get there by, the middle to end of summer with great vaccine coverage?
Yeah, so a lot of this is going to be driven by what happens with hesitancy and confidence. If people are vaccinated, if let's say we get to 60, 70% vaccinations by June, and we certainly will have the vaccines to do it, then I can imagine case numbers could get to 10,000 a day. And by the way, 10,000 a day, just as a way to kind of think about it, probably means about 100 people a day or less dying of the disease. That puts it on the sort of same par as the flu. That about 30,000 Americans die every year of the flu. So at that level, you're going to have COVID causing about as much morbidity and mortality as influenza. And that is a very, very different ballgame, right? So that's, I think, part of the mental model that a lot of people are using. We're not going to get to zero COVID. We're not going to get to zero risk. But what if we made this not that much more challenging? In terms of timeline, I think the summer is going to be really quite terrific. We're going to have a very good summer, something very close to a normal summer. There are two sets of issues. Kids still will not be vaccinated, so we'll have to be a little bit careful around kids. I'm pretty optimistic about the fall, but this virus is looking increasingly seasonal. So I can imagine a bump in cases once we get into November, December, January. Not a huge spike, not a, oh my God, shut the country down kind of thing, but where we're going to have to maybe ratchet up precautions, maybe send people home more and do more remote work during those months. Maybe we could pull back a little bit on restaurant capacity, more mask wearing. Nothing, I think that's going to be hugely disruptive, but it will be something we'll have to deal with.
And what do you think back to work looks like? When most of us are vaccinated, but maybe not all of us are, and kids maybe won't be covered completely yet, depending on the timing for the vaccine getting available for them. Will we be having to wear masks? Should our employers be thinking about distancing us more? What do you think that looks like when we're all back in the office?
Yeah, so a couple of things. I think one is we're certainly going to see a lot more flexibility in the workplace. In the idea of like remote work, where in the past you had to fill out forms and beg for permission. That's going to change. And I think a lot more places are going to allow for remote work where that's possible. Second, if you have a workplace where everybody's vaccinated, bringing people back in and not requiring masks is totally safe. And I think we're going to see that. So the question will be for employers, do you let unvaccinated people come back to work? And if you do, how do you help them? How do you manage their safety? Do you require masks for unvaccinated people? It starts getting weird if some people are walking around without masks and other people are wearing masks. So there's a lot of complexity we have not sorted out, a lot of policy issues. But in general, if you can have a vaccinated workplace, boy, that makes it relatively safe to be, pretty close to normal. Maybe a little extra spacing, a little extra improvements in ventilation, but probably not that different from where we were before.
And how do you think about the situation for kids? Obviously, for many people, going into the office, having kids back in school or in daycare is really important. But also, what are the risks for them before they're able to get vaccinated? And what are your hopes for the availability and then the reach of the vaccine for them later this year?
Yeah, so I think what we have learned is over this past year is that there are ways of getting kids back to school safely in a way that's safe for them and safe for teachers. Most states are allowing teachers to get vaccinated early, and that's, I think, a good thing. So I do expect most schools to be able to bring kids back in this spring. Obviously, summer, you're going to think about things like summer camps. The challenge over the summer will be the kids will not be vaccinated, and you're going to want to be careful about not letting large outbreaks happen among kids. They still can get sick. Some of them can still have some complications. I expect later in the summer, August maybe, for older kids, 12 and older, maybe, and I say maybe because we just don't know when the data will be available, but I can imagine them getting vaccinated. It'll help with the fall. The problem is going to be younger kids. And my best guess is we're probably mid to late fall, maybe even later, before we have really good data on safety and effectiveness of these vaccines in younger kids. And so there's just going to be some challenges that we're going to have to manage as a country as we go through the summer into the fall.
All right, Dr. Ashish Jha, it is always such a help to get to hear from you. Thank you so much for kicking off this event for us today.
Thank you for having me.
All right, Tyler, back to you.
Boy, there was so... All right, Meg, thank you very much, and thanks to Dr. Jha. He has been really a stalwart throughout this pandemic from its earliest days early last year.